welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I have a question for you all today. Neurological disorders, corticosteroids and fractures, are they all interlinked? Now I know there are three different dimensions that I just mentioned, right? Exactly that is what a recent research that was published in the Journal of Postgraduate Medicine, Education and Research talks about. The study that I'm talking about brings out the effects of long-term use of steroids on bone health. We all know that corticosteroids are one of the most frequently used groups of medications advised by all the clinicians across all medical specialties. Now, specifically with the advent of neuroimmunology as a branch, as well as its recognition of many immune-mediated neurological disorders, the need for steroid use has substantially increased. Corticosteroids are known to cause a reduction in bone mass due to increased bone resorption and reduced formation, the inhibition of interstitial calcium transport, the increased urinary calcium excretion, the increase in the osteoclastic activity, the induction of the interleukin-6 receptors in the skeletal cells, the decreased levels of osteocalcin, alterations in the growth hormones, as well as complex actions on the skeletal cell gene expression have all been implicated. Now, patients with neurological disorders have an additional risk of developing bone loss. Interestingly, neurological patients have been very poorly represented in trials on preventive treatments for osteoporosis despite being them at an increased risk. So many disorders like various neuromuscular diseases, Parkinson's disease, etc. have been associated with an increased risks of falls as well. Now, falls we all know are the most common as age advances and they can happen to anyone, and up to 5% of the falls in the geriatric population are known to cause fractures. Now, patients with epilepsy not only have an increased risk of falls but are often at a higher risk because of their exposure to medications like phenytoin, phenobarbital, carbamazepine, valproic acid, etc. While the use of steroids is unavoidable on many occasions, precautions should definitely be advocated to minimize the risk. Patients who require prednisolone at a dose of 7.5 mg or even more on a daily basis for 6 months or more should be considered at high risk for the development of early osteoporosis. About even 50% reduction in the fracture rate can be obtained with a judicious and timely treatment adopted. Nonpharmacological therapies like balance and gait training, the use of hip protectors, weight-bearing exercises can substantially potentiate the prevention of fractures in these patients. Lifestyle modifications with alcohol and smoking cessation should be advised to all patients who have been initiated on corticosteroids. So the ultimate functional status of patients with neurological disorders depends upon multiple factors. While steroid treatment is the cornerstone therapy in many immune-mediated neurological diseases, timely prevention of osteoporosis may offer a better disease course with a better quality of life. That's all for today from the Journal Club end. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.